Hi, today in this presentation we are gonna discuss the opioids.
Opioids are derived from opium poppy plants and synthesized in a laboratory to either create prescription pain relievers or illicit drugs. Some well-known prescribed opioids include morphine, fentanyl, and oxycodone. These opioids are typically used to manage pain by binding to opioid receptors within the brain, blocking pain signals and producing feelings of great pleasure and euphoria. While opioids are extremely successful in managing pain, they can also be extremely addictive, leading to some patients becoming physically dependent on these drugs. Opioids can have many detrimental effects on one's health, leading to issues such as impaired cognitive function, drowsiness, and respiratory depression.
Okay, I'm going to talk about kinds of opioids. So we differentiate between endogenous and exogenous opioids. Endogenous opioids, as the name says, are opioids that are produced by our body naturally, and between them are endorphins, dynorphins, and enkephalins. We're going to talk about later about this because each of them have specific receptor selectivity or specificity, which means they are bound or have more affinity to one specific opioid receptor. And exogenous opioids, which come from an external source, such as heroin, morphine, and opium, and they imitate the effects of endogenous opioids. So, as I talk about later, each one of the endogenous opioids has a specific receptor selectivity. For example, endorphins are bound to Mu receptors, which they induce a state of euphoria when activated. Enkephalins are bound to delta receptors, which causes anxiolytic effects, and dynorphins are bound to kappa receptors, which, when activated, they cause agonist-induced dysphoria, which is the opposite effect of Mu receptors. And last, how do opioids activate the reward circuit? So they do it by when opioid receptor binding on GABAergic neurons, less GABA is released into the ventral tegmental area, which is an area of the brain in the tegmentum where most dopaminergic neurons lay. And since GABA is the main inhibitor in neurotransmitter, it makes sense that if less GABA is released into that area, in turn more dopamine is released. And where is it released? Into the nucleus accumbens, which is the main area in the reward circuit. And I'm going to talk about lastly about the analgesic effects or pain relief effects of opioids. Okay, so opioids send signals that excite serotonergic activity down into the rave nuclei, where most serotonergic neurons lay, and the action of these serotonergic neurons excites the action of inhibitory interneurons of the spinal cord, which eliminate sensory input signals of pain.
So these are the medications used in the treatment of opioid addiction. So firstly we have methadone, which is a synthetic opioid agonist. It works by binding to the same receptors in the brain as opioids, which reduces cravings and withdrawal symptoms without causing the euphoric high. Secondly, we have buprenorphine, which is a partial opioid agonist. This also binds to opioid receptors, but with weaker effects than full agonists like heroin. It reduces cravings and withdrawal with a lower risk of abuse due to its ceiling effect. Thirdly, we have lofexidine. This is a alpha-2 androgeneric agonist. This mitigates physical symptoms of withdrawal by calming the body's response to stress and anxiety. Lastly, we have naltrexone, an opioid antagonist. This blocks opioid receptors, preventing the effects of opioids and reducing cravings.
Now we are gonna discuss the opioid use disorder, which is characterized by these three stages, which is going to affect the mesolimbic system, which is in charge of the reward pathways in the brain, as well as changing the neuroplasticity in the brain by modulating the different neurotransmitters and neuromodulators in 18 different systems. For instance, we are going to discuss the dopamine, which is a brain chemical that is tied to the pleasure that we feel from drugs. When opioids are used, dopamine is released in this brain area and is also going to reduce the chemical called GABA, which is going to inhibit dopamine. So as a result, we're going to increase the release of dopamine. With repeated drug use, dopamine release drops, making pleasure less intense and stress more common. This leads people to avoid distress rather than seek for euphoria. Now we're going to discuss the locus coeruleus, which is the part of the brain which contains many noradrenergic neurons and helps regulate our body's functions and alertness. Tolerance and dependence on opioids happen when these drugs attach to opioid receptors in the LC, which are going to inhibit the adenyl cyclase. This is going to release norepinephrine and is going to lead to withdrawal symptoms. This attachment reduces the release of a chemical called norepinephrine, which is going to make us feel more sleepy, slow our breathing, and lower our blood pressure. Long-term opioid use changes how the LC works to try to keep things balanced. And answering to this question, there is going to be a rush of activity in the LC and adenyl cyclase, causing more norepinephrine to be released and making withdrawal symptoms worse. So the solution is to block norepinephrine so we can avoid and ease the symptoms.